Most women check for a lump. That's it. One sign. And because they don't feel a lump, they assume everything is fine. But here's what nobody tells you. Breast cancer can grow inside your body for months, sometimes years, without ever forming a lump you can feel. And the signs it does show? Most women mistake them for something completely harmless. By the time they figure it out, the cancer is already at a dangerous stage. So if you think you know the warning signs of breast cancer, you might want to keep watching. Because what's coming next might completely change how you look at your own body. Let's start with something most women have never even heard of. Skin dimpling. Not a lump. Not pain. Just a small area on your breast that looks slightly pulled in, like a tiny dent in the skin. It can look like the skin of an orange. Rough, uneven, almost like a pore that's suddenly more visible. Most women see this and think it's just a change in skin texture. Maybe dryness. Maybe weight gain. They ignore it completely. But this is one of the earliest signs that something is growing underneath, pulling the skin inward from the inside. And it can appear before any lump is even detectable. If you've ever noticed an unusual texture change on your breast skin, don't wait. Don't assume. Get it checked. Now here's one that almost nobody talks about. Breast pain. Yes, pain. Most women are told that breast cancer doesn't hurt. And while it's true that early-stage breast cancer is usually painless, that's not always the case. Some women experience a dull, persistent ache in one specific area of the breast. Not both sides, just one. And it doesn't go away after their period ends. They take it as a hormonal thing. They take a painkiller and move on. But persistent, localized breast pain that isn't tied to your cycle, that's your body trying to tell you something. And ignoring it because cancer doesn't hurt could cost you everything. Here's where it gets even more unexpected. Your nipple. Most people focus on the breast tissue itself, but the nipple tells its own story. One of the hidden signs of breast cancer is a nipple that suddenly turns inward, what doctors call nipple inversion. If your nipple has always been inverted, that's normal. But if it recently started pulling inward on its own, that is a red flag. And it's not just inversion. Discharge from the nipple, especially if it's bloody or only coming from one breast or happening without squeezing, that's another warning your body is sending out. Most women feel embarrassed about this. They don't tell their doctor. They assume it'll go away. It often doesn't. But the symptom that gets missed the most, it has nothing to do with the breast at all. Swelling in the armpit or around the collarbone. No pain. No lump in the breast. Just a slightly swollen area near your underarm that you might mistake for a swollen lymph node from a cold or even a reaction from your deodorant. Here's what's actually happening. When breast cancer begins to spread, the first place it often travels to is the lymph nodes, and those are located right in your armpit and collarbone area. So sometimes the armpit swelling shows up before any breast symptom does. If you have persistent swelling in your armpit that doesn't go away within 2 to 3 weeks, that is not something to brush off. Now this one will surprise you. A rash. On the breast, not itchy skin from your bra, not an allergic reaction. A red, irritated, warm rash that covers part of the breast and just doesn't respond to creams or antihistamines. This is actually a symptom of one of the most aggressive forms of breast cancer, inflammatory breast cancer. It's rare, but it moves fast. And because it looks like a skin issue, women treat it like a skin issue. They try lotion. They try antifungal creams. Weeks pass, nothing changes. And all that time, something far more serious is progressing underneath. If you have a breast rash that lasts more than a week and doesn't improve with standard treatment, please see a doctor. Not next month. Soon. Here's something else women almost never connect to breast cancer. Fatigue, not regular tiredness. Not, I had a long day fatigue. A deep bone-level exhaustion that doesn't go away even after sleeping. It's the kind of tired that makes you feel like something inside your body is working overtime, because something actually is. Cancer cells consume enormous amounts of energy. They hijack your body's resources, and the result is a constant, unexplained exhaustion that doesn't match your lifestyle or sleep schedule. Most women blame stress, hormones, age, life, and they push through it, but unexplained persistent fatigue, especially when combined with any other symptom on this list, is not something to explain away. Now let's talk about something almost invisible. Changes in breast size or shape, not dramatic changes, subtle ones. One breast suddenly looks slightly larger than the other, or one side feels heavier, or the shape of one breast looks slightly different when you raise your arms in the mirror. Most women assume it's just their natural asymmetry. And yes, breasts are naturally uneven. But a sudden change in asymmetry, one that wasn't there before, that's different. That's your body shifting because something inside is changing the structure. This is why self-examination in front of a mirror with arms raised is so important. You're not just looking for lumps. You're looking for shape, texture, symmetry, any shift that wasn't there last month. And here's the part most women never reach because they stop paying attention long before this point. Back pain, upper back pain, between the shoulder blades, persistent, aching, the kind that feels deep inside the bones rather than in the muscles. Women in their 30s and 40s chalk this up to posture, desk work, or old injuries. But in some cases, especially when breast cancer is spread, this kind of bone pain is one of the earliest signals. It's not happening in your back because of your posture. It's happening because cancer cells have traveled there. This doesn't mean every backache is cancer. It's not. But if you have back pain that is persistent, unexplained, not improving with rest or physiotherapy, and especially if it's combined with breast changes, it deserves a proper medical evaluation. Here's what makes all of this so dangerous. Each of these symptoms on its own sounds harmless. A rash, some fatigue, a little back pain, nipple discharge, a skin texture change. Any one of these in isolation is easy to dismiss, and that's exactly what most women do. They dismiss one, then another, until enough time has passed that the cancer has moved from stage 1, where survival rates are above 99%, to stage 3 or stage 4, where everything becomes harder, longer, and more uncertain. The cancer didn't change. The window of opportunity did. So what should you actually do? Don't wait for a lump. Don't wait for obvious pain. Don't wait for something that feels serious enough to bring up with a doctor. If something in your body is different, persistently different, that alone is reason enough to get checked. Monthly self-exams, annual mammograms after 40 or earlier if you have a family history, and most importantly, trust your instincts. You know your body better than anyone. Most women spend their entire lives believing one thing, and if there's no lump, there's no problem. That single belief has cost more lives than most people realize. Because breast cancer doesn't always announce itself with something you can feel. Sometimes it grows quietly, invisibly, hiding behind symptoms so subtle that even the most health-conscious women walk right past them every single day. Here's what actually happens inside the body. A tumor doesn't need to be large or palpable to start causing changes on the surface. Even in its earliest stages, a growing mass underneath the breast tissue begins pulling surrounding structures, skin, ligaments, fat, inward. And that pull shows up on the outside in ways that have nothing to do with a lump you can press and feel. One of the first things it does is change the skin. Not dramatically. Not in a way that screams danger, just a small patch that looks slightly different. A faint dimple, a subtle roughness, an area that looks almost like the skin of an orange, with enlarged visible pores and an uneven surface. Most women see this in the mirror and think dry skin. They apply moisturizer and move on. The window to act early quietly starts closing. What makes this even more dangerous is that this dimpling can appear on any part of the breast, not just the front. The side, the underside, areas women rarely examine closely or think to look at during a self-check. So even women who do perform self-exams miss it completely because they're pressing for lumps instead of looking for surface changes. And here's the part that should genuinely concern you. A tumor causing visible skin dimpling can still be too small to feel with your fingers. That means by touch alone, which is how most women self-examine, the breast feels completely normal. No mass, no hardness, no irregularity. Everything feels fine. But the skin is already showing signs that something beneath it is pulling, growing, and restructuring tissue from the inside. This is why standing in front of a mirror with both arms raised, actually looking at the shape, texture, and symmetry of each breast is not optional. It's not extra. It's the difference between catching something at stage 1, when it's almost always survivable, and missing it entirely until the body has no choice but to make the signs impossible to ignore. You said, expand key point 2 in 400 words. Please hooked up viewers, but don't subheadings or ending sentence. Every single like will very informative and affect my audio. Most women look at their nipples every single day without ever realizing what they're actually supposed to be looking for. And that gap in awareness, that small silent blind spot, is exactly where breast cancer hides longest. Because the nipple and the skin surrounding it are not just surface features. They are direct windows into what is happening deep inside the breast tissue. And when something changes there, the body is not being subtle. It is sending a signal. The problem is almost nobody is taught how to read it. Let's start with nipple inversion. If your nipple has always pointed inward since adolescence, that is simply your anatomy. That is normal. But if a nipple that has always pointed outward suddenly begins pulling inward, slowly, gradually, without any injury or obvious cause, that is your breast tissue being pulled from underneath. A growing mass inside the breast can attach itself to the ducts that connect to the nipple and begin retracting them inward as it expands. It does not hurt. It does not feel dramatic. It just quietly changes the shape of something you see every day, and most women assume it is hormonal or temporary and never bring it up to a doctor. Now here is where it gets more serious. Nipple discharge. Not discharge that happens when you squeeze. Many women experience that, and it is often harmless. The discharge that demands attention is the kind that appears on its own, without any pressure, soaking into your bra without you doing anything. And if that discharge is bloody or dark or coming from only one breast consistently, that is not something your body does randomly. That is a duct inside the breast that is compromised, irritated, or being invaded by abnormal cells that are disrupting the normal architecture of the tissue. And then there is the skin directly around the nipple, the areola. Changes in color, sudden flaking, persistent itching, or scaling that looks almost like eczema but never fully heals, these are not skincare problems. There is actually a specific type of breast cancer called Paget's disease that begins exactly here, on the surface of the nipple and areola, disguising itself as a harmless skin condition for months while quietly advancing underneath. Women treat it with cream. They switch soaps. They wait for it to go away on its own. And the cancer uses every single one of those wasted weeks to grow deeper, spread further, and become exponentially harder to treat than it ever needed to be. Most women never think to check their armpits when they are worried about breast cancer. And that single oversight, that one overlooked area of the body, is exactly why so many cases are caught late. Because the armpit is not separate from your breast health. It is directly connected to it. And sometimes, it is the first place in your entire body that shows a sign that something is wrong inside the breast, before the breast itself shows anything at all. Here is the biology that makes this so important to understand. Your body has a network of lymph nodes, small, bean-shaped glands that filter fluid and fight infection. And a significant cluster of them sits directly in your armpit, with more running along your collarbone and down the side of your chest. These lymph nodes are essentially the drainage system for your breast tissue. Every day, fluid from your breast passes through them, which means when abnormal cancer cells begin breaking away from a tumor inside the breast, the very first place they travel to is these lymph nodes. Not somewhere distant, right there, in your armpit, sitting underneath your skin where you apply deodorant every morning without a second thought. What this means in practice is terrifying in its simplicity. A woman can have zero detectable changes in her breast, no lump, no skin dimpling, no nipple changes, and yet have a swollen lymph node sitting in her armpit that has already received cancer cells from a tumor too small to feel. The swelling is not always dramatic. It does not always feel like a hard, obvious mass. Sometimes it is just a subtle fullness, a slight puffiness, a feeling that one armpit is not quite the same as the other. Something that is incredibly easy to blame on a razor nick, an ingrown hair, a reaction to a new deodorant brand, or a mild infection that you assume will clear up on its own. And here is what makes this window of detection so precious and so frequently wasted. When cancer is found only in the lymph nodes and has not yet spread beyond that regional area, treatment options are still highly effective and survival outcomes are dramatically better than when the disease has traveled further. That swollen armpit is not just a symptom, it is a checkpoint. It is your body drawing a line and saying this far and no further if you act right now. But when women dismiss armpit swelling for weeks, sometimes months, that checkpoint gets crossed quietly without anyone noticing. The cancer that was contained becomes the cancer that is moved. And the difference between those two realities is not medical complexity. It is simply the decision to pay attention to a part of the body that most women never think to include in their self-examination at all. Most women who are exhausted blame their schedule. Most women with persistent back pain blame their posture. And in doing so, they unknowingly hand cancer exactly what it needs most: time. Because fatigue and back pain are so common, so easily explained away, so deeply woven into the fabric of everyday modern life, that when they appear as early signals of something far more serious, they are almost never taken seriously. And that normalization of suffering is one of the most dangerous things happening to women's health right now. Here is what is actually happening inside the body when cancer-related fatigue sets in. Cancer cells are not passive. They are aggressive, fast-dividing, and enormously energy-hungry. As they multiply, they hijack your body's glucose, your nutrients, your immune resources, pulling everything toward themselves and away from the systems that keep you feeling functional and alive. The result is not ordinary tiredness. It is a heaviness that lives in your bones. A fatigue that does not respond to sleep, does not lift after a rest day, does not improve no matter how early you go to bed or how many vitamins you take. Women describe it as feeling like their body is running a race they never signed up for. And they are right, because internally, it is. What makes this symptom so easy to dismiss is that it arrives without drama. There is no sudden collapse, no obvious physical change, just a slow, creeping exhaustion that worsens gradually over weeks and months. Women adjust their lives around it. They cut social plans. They drink more coffee. They tell themselves they are just getting older, just more stress, just going through a hormonal shift. And every single one of those explanations feels completely reasonable, which is exactly what makes this symptom so devastatingly effective at going undetected. Now here is the part about back pain that most women have never been told and genuinely need to hear. When breast cancer spreads beyond the breast and lymph nodes, one of the first places it travels to is bone. And the bones it targets most frequently are the spine, the ribs, and the pelvis. When cancer cells settle into spinal bone, the pain they generate does not feel like a pulled muscle. It does not feel like tension from sitting at a desk. It feels deep, internal, aching in a way that does not change position with movement or improve with massage or physiotherapy. It is pain that lives inside the structure of your body rather than on the surface of it. Women with this symptom spend months visiting chiropractors. They buy new mattresses. They do stretching routines. They take anti-inflammatory medication that takes the edge off temporarily but never fully resolves the pain. And all of that time, the actual source of that pain is progressing, spreading, and making the road ahead longer and harder than it ever needed to be. The back is not the problem. The back is just where the problem decided to make itself known. Most women know that early detection matters. They have heard it before. It is printed on awareness ribbons and repeated in health campaigns every October. But knowing it and truly understanding what that window of early detection actually means, what it looks like in real numbers, in real survival outcomes, in real quality of life, those are two completely different things. And that gap between hearing information and genuinely internalizing it is the reason women continue to present at clinics with late-stage breast cancer in 2024, despite decades of awareness efforts. Here is the reality that should stop every woman in her tracks. When breast cancer is detected at stage 1, when the tumor is small, contained, and has not spread to lymph nodes or surrounding tissue, the 5-year survival rate is above 99%. Not 70%, not 80%, above 99%. That means nearly every single woman who catches it at that stage goes on to live. The treatment is less aggressive. The surgery is often less extensive. The recovery is faster. The psychological and physical toll is dramatically lower, and the chance of the cancer returning is significantly reduced because it was eliminated before it had the opportunity to establish itself anywhere else in the body. Now contrast that with stage 4, when the cancer has traveled to distant organs like the lungs, liver, brain, or bones. The 5-year survival rate drops to approximately 28%. Same disease, same cancer. Completely different outcome, determined almost entirely by how early or how late it was found. Those numbers are not just statistics. They represent the direct measurable consequence of every dismissed symptom, every delayed appointment, every month spent waiting to see if something unusual would resolve on its own. And here is what the awareness campaigns rarely tell you about early detection. It is not just about mammograms. Mammograms are critical, non-negotiable, and every woman over 40 should be having them annually without exception. But mammograms alone are not enough. Tumors can be missed in dense breast tissue. Inflammatory breast cancer does not always show up clearly on imaging, and the interval between annual screenings is 12 full months, which is an enormous amount of time for a fast-growing cancer to progress from detectable to advanced. This is why monthly self-examination is not optional, not extra, not something only anxious women do. It is the layer of protection that exists between your annual mammograms, the practice that puts your own eyes and hands on your body regularly enough to notice when something shifts, when something changes, when something that was not there last month has quietly appeared. Women who perform consistent self-exams are not being paranoid. They are being precise. They are giving themselves the one advantage that no screening schedule alone can provide: continuous personalized knowledge of their own body over time. And that knowledge, acted upon quickly, is what transforms a potential tragedy into a story of survival that never needed to be anything more than a difficult few months that a woman moved through and left completely behind her.